ultimately, by the end of 2026, all payers need to have an API in place. So that means if you're working towards this, it's a really big ask and not a small task. So it needs to be done in the next 3 years. So what does this really mean? Essentially, this requirement breaks down the prior auth transactions into 3 categories. The first is called the coverage requirement discovery, or CRD, and that is the transaction that answers the question for the provider: is this prior auth, does this procedure require a prior auth for this patient? The next transaction is the document templates and rules transaction, and this is where the payer tells the provider, for this patient and this requirement, what do we need to see? What are the clinical requirements and what do you need to submit? And then the last transaction is the prior authorization support, or PAS transaction,